approached New Orleans, an incident occurred where I had a panic attack. Here is my luggage that I had taken out of my car to go with me to Texas. I had my clothing in it, and there is the bag there. That is the large bag, and here is the smaller bag. And I also had my purse with me. So I had those 3 items and a couple of other things. And as I said, I took them out of my car and left the car at the automotive repair shop. I would like to continue this story and let you know what I endured while traveling through the state of Louisiana. The driver has suggested that I let him go pick up his truck in New Orleans and he could give me a ride on into Laplace. I told him no, I was uncomfortable with that. And Hi, my name is Karen Tanner. I live in Dallas, Texas, and I'm making this video documentary to inform the public as to an occurrence that happened to me in Louisiana as I was traveling through their state. I had a vehicle breakdown in Mobile, Alabama, and took it to a automotive repair shop, told them that I would be back in a week or so to pick up my vehicle. I had to hitchhike a ride through the state of Louisiana on into Texas. I took a ride from a truck driver and went on through the state with him. And as we approached New Orleans, an incident occurred where I had a panic attack. Here is my luggage that I had taken out of my car to go with me to Texas. I had my clothing in it, and there is the bag there. That is the large bag. And here is the smaller bag. And I also had my purse with me. So I had those 3 items and a couple of other things. And as I said, I took them out of my car and left the car at the automotive repair shop. I would like to continue this story and let you know what I endured while traveling through the state of Louisiana. The driver has suggested that I let him go pick up his truck in New Orleans and he could give me a ride on into Laplace. I told him no, I was uncomfortable with that. And he went ahead and he drove me to Laplace, and he parked his truck at a Shell station off of the I-10. And when he parked, I went to get my bags, and he got up and came and stood right in front of me and suggested that I give him a massage. I had told him I was a massage therapist. And I declined his offer, told him I was uncomfortable with that I wanted to get another ride and make it on into Texas. He became a little aggressive, and whenever I became a little threatened and felt unsafe, I grabbed my bag, I opened the door, and I threw the small bag out. I then told him to please give me my other bag, and a struggle began. He wanted me to get out of the vehicle first and said he would hand it to me. I said, please give me my bag. So there was a struggle. He took it and he threw it, was very aggressive, and I got out and I walked across the street to the pilot on the eastbound side of I-10. Whenever I got there, I went in. I was quite disturbed. I went to the restroom and bought a soda, went outside and smoked a cigarette. And later, one of the managers, she asked me if I was all right. I kind of explained, briefed her on the incident. And she asked me if I was all right. I felt at that point threatened and like I was having a panic attack. And she called the paramedics. I spoke to paramedics and thought that I could just go over to the ER room and talk with a doctor and calm down. And they took me to the ER room. I never really got to speak to someone where I sat down and told them exactly what had happened and got a good diagnosis or good information. In other words, they held me there for the 2 days and watched me and monitored me. They took blood, which proved that I had no narcotics or any type of drugs or alcohol in my system. I was treated very nicely there and trusted them. I was told that they were trying to find a place for me to go to possibly get some counseling, and I agreed to that. So I've been there 2 days, and the nurse or doctor came in and told me that she found a place for me to go. A black sedan came and picked me up. They put my luggage in the trunk of the car, and when I got in the car, I realized that everything was locked, and there were monitors and videos in the car as well. And it was a patient transportation type of vehicle. They were driving 85 miles an hour. They stopped and changed drivers 3 times. It was getting dusk. It was getting dark. And the locations they stopped to change drivers was a little scary because everything was closed down. And I questioned them and really had no idea where I was going. I did not realize that they were taking me 100 miles away to Jennings, Louisiana. And it was a nursing home. I didn't feel like a nursing home was the appropriate place for me, but I thought perhaps they had good doctors there. So I went along with what they were telling me, and I trusted them. Whenever I got to the nursing home, it was called Senior Healthcare in Jennings, Louisiana. Everything seemed very nice. They were very polite and courteous to me. They told me that they would have to go through my bags and take everything out to check it, and I could keep out a few changes of clothing, but they would have to write on them. I agreed to that. They told me that I could have smoking, and I had my own cigarettes. I left the bags in there at their office, and the lady took me out, and we smoked a cigarette. Whenever I came back in, almost immediately, I felt a little threatened by what I saw next. My bags had all the contents out, strewn all over their office. A lady was writing on all of my items, my undergarments, and all of my clothing. It wasn't just a few changes of clothes. She did that too. And so I asked, what's she doing? Oh, well, I thought we were going to do this together. And so I was lied to. I knew that at that point they were liars. So I continued to just be in compliance and stayed there for several days with no incident. Whenever I was asked, I think it was the 3rd day that I was there, I was informed that the doctor had taken my smoking privileges away. And that went on for a day or so with me being compliant until I began to complain about it. But I'm going to go back to the initial consultation with the doctor, Dr. Bromlett. Whenever I first went into his office, there were 3 ladies sitting there at a conference table with him. And I felt that was kind of unusual. I could understand 1 person or 2, but 3 people sitting there looking at you. I wanted to sit and have a conversation with the doctor and try to figure out what to do about the panic attack that I had. And that didn't happen. As soon as I started talking to him, his first questions were, "Are you homeless?" The next questions were, "What were you doing?" And whenever I tried to explain to him, I said, "Maybe you might not believe what I have to tell you, and I never got to tell him. He immediately snapped at me and said he did not believe me, although I never told him anything. I mentioned the words MK Ultra, and he became very angry. I think that the three women should be questioned about that because they seemed very surprised at his anger. And that pretty much ended our conversation. And so I continued just to stay there and never really got any medical treatment. Most of the patients there were geriatric patients, some of them incoherent. So the lady that did speak every day, it was on a grade level, educational level, and had nothing to do really with me. I was in the inappropriate place. I felt it was very insulting, and very bad medical decisions made for my well-being. Pardon me. I continued on enduring, pardon me, what was going on, and wasn't too pleased about it. I never really expressed too much of that. I just was very compliant. The third or fourth day, I think it was, the third day, I believe, they took my smoking privileges away with no explanation. The doctor was just being an ass. So, in other words, whenever I questioned why this happened, I got no explanation. I endured it till the next day. They would deliberately walk in front of me, going out to the smoking break with me not included. Again, I questioned it, and I was told to lower my voice. Well, I went to my room, I wrote a statement and a request for release based on that I had been there many days. Nothing was provided for me as far as any type of real mental health evaluations or consultation, and requested my release. By law, I knew I could do that. It was within moments. I went back up to talk to her. She told me to lower my voice again, which was an exaggeration of what was going on. I went back down the hall to my room and sat on my bed, and about 7 or 8 women, I can't remember how many, came running in, and they attacked me, and they hit me with a needle of 2 different types of drugs, and I was drugged and held down and attacked by those people. Within 15 minutes, they forced me to have a consultation with the coroner and for a medical evaluation. So this indicated to me all of that was pre-planned to ensue an argument, to ensue and provoke me, and so that they could attack me and make false reports of the incident to make it look as though I had behavioral problems. Upon talking to the coroner, he asked me questions and I answered him, but I was under the influence of the drugs that they had attacked me with. I feel like that was an unfair treatment, unfair evaluation. I do recall the entire conversation. He asked me what was going on. I told him I had to hitchhike. The car had broke down. Based upon what I told him, he committed me so that they could hold me longer. This went on and on. I woke up in the middle of the night. They were taking blood out of my arm, which was illegal. They should have requested my consent for that. I was unconscious when that was happening from whatever it was they were doing to me. Finally, the next day, I was told I was going to be released. They didn't tell me to where. I had a conversation with one woman about a shelter, and I'd already told her I didn't want to go there, and she said she found another place. So I was never very well informed. I also handwrote them a letter that I was requesting. Upon my release, I was requesting my medical documentation. And they were very arrogant about the whole thing. Whenever I was released, they handed me an envelope. When I opened the envelope, it had my letter to them in it. Very arrogant, these people are, and that was very illegal. I should have been able to have and review my medical records, but they were probably full of lies. Upon the day